So we're talking about the GAE, genicular arterial embolization procedure that I had found out about through Dr. Conaway's office. And for years I followed the traditional orthopedic route, relying on cortisone shots. But those shots were wearing off. I was taking them once a year, then they were reducing to once a quarter. So the pain relief was shortening. So that's when I discovered Clarity and Dr. Conaway. I had been a patient of his in the past, and I noticed this on the website, and I hadn't seen too much marketing material on this very procedure, but it intrigued me. So the concept was pretty, made sense to me. It target the root cause by shutting down the excess blood flow feeding the inflammation. He described it to me as a garden hose that's watering my garden too much, and I needed to kind of cinch the hose a little bit to reduce the blood flow and the inflammation that was going to my knees. So I did a lot of research, and as a result, I spoke with him, took a little test, and very minimal, and I was ready to do both knees. But I decided to do the right knee first, and the results a month and a half later have been nothing short of miraculous for me, because not only is the right knee doing fantastic, but a month later, as I said, the pain in my untreated left knee is completely gone. I don't know if I was favoring it or not, but because I hadn't heard too many testimonials, I kind of took a leap of faith here. I hadn't heard anyone else really doing this procedure, but through my research, it just made way too much sense. But today I can confidently tell you that for me, the GAE procedure, which really, I did a short acronym, it was gone and emptied of pain, is really what GAE to me meant. But the alternative was using a lot of ibuprofen, Tylenol, and there just isn't any more need for that. And plus, I'm not killing my kidneys or upsetting my stomach with ulcers by taking that. So the physical structure of my knee really hasn't changed. But the debilitating pain is gone. And for me, if you're trapped in a cycle of cortisone shots, too much ibuprofen, too much Tylenol, this is such a wonderful option, and certainly a step in between the traditional pain cortisone shots and getting full knee replacements. As I said, the structure of my knee is still the same, but the debilitating pain is gone.